Hi, this is Dr. Roy Mathews, and today we're going to be talking about plantar fasciitis or heel spur syndrome. Plantar fasciitis is the most common symptom a podiatrist will see in their office. Plantar fasciitis presents as heel pain in the morning when we get out of bed most commonly. That eases off as we begin to walk or move around, and then will get worse during the day, especially if we've sat down for a period of time or if we've been standing on our feet for long periods of time. The plantar fascia is a soft tissue band that starts in the heel of the foot and works its way up through the arch of the foot and into the toes. When we stand for long periods of time or walk, overpronation when the foot rolls in towards the center of gravity will cause the arch to unlock and the arch to lower, and that will then stretch out the plantar fascia and it will pull on that heel insertion point and present as pain. So the most common way that we treat plantar fasciitis is by supporting the foot. Anti-inflammatories, icing, and stretching are all very good in its acute phase, but when plantar fasciitis has been going on for months and months, we need to treat the cause of the problem, which means supporting the arch of the foot and taking the tension out of the plantar fascia. One way that we can do this is by wearing good supportive shoes. So a shoe that is supportive through the arch of the foot and has some support within the arch is good. So replacing the insoles of a regular running shoe with an off-the-shelf support may be helpful. The next step would be presenting to your podiatrist and having them tape the foot. Support the foot with a tape on to support the arch for a few days at a time and see if that helps. If that helps, then you may be benefited by going into a custom orthotic, which will support the arch of the foot by not allowing the arch to come down. People think they need softness and cushioning under the foot, but they actually need support under the arch of the foot. And if they have support under that arch, it can take the tension out of the plantar fascia. The next way that we can treat it is with cortisone injections to calm down the inflammation, but this is a temporary band-aid to relieve some of the symptoms. Laser therapy is a new therapy that we've been using for plantar fasciitis, which has been extremely exciting and very successful in reducing the scar tissue and damage within the plantar fascia, and results are felt immediately. In the worst case of plantar fasciitis, this can go on towards surgery where part of the plantar fascia is needed to be released. So again, remember, if you have heel pain that is especially worse upon arising in the morning and it's been going on for a few weeks, you should seek medical attention right away. This has been Dr. Roy Mathews, and I hope that helps.